You're listening to the Mike Bullard Podcast on News Talk 1010.
I like big butts and I cannot lie. You other brothers can't deny.
Big show today. Got my first in-studio guest. Dr. Martin Jugenburg is here, and he's going to be part of the anti-aging show. And he's the man when it comes to Brazilian butt lifts. I don't know why they're called Brazilian butt lifts, but we'll get to that with him. Going to talk about the Chilean miners, and I've got Dan Savage on the show, syndicated gay columnist in the U.S., and a guy I've always found intriguing, and his insights into outing, et cetera, especially prevalent today because of the tragedy that occurred in New York last week. But right now, Dr. Martin Jugenburg. Am I pronouncing that right?
Yes, you are perfect. Thank you.
The J is not only silent, but it's a different letter.
Yes.
Yes, all right. So, Dr. Jugenburg, first of all, thanks for coming.
Oh, thanks for having me.
And we were talking just before the show started, and you said something that really twigged me. I couldn't believe it. Now, plastic surgery goes back how far?
Maybe 5,000 years to ancient India.
No kidding, huh?
Yeah.
No anesthetic, though.
I'm not quite sure what they did. Maybe a little bit of alcohol, a little bit of hammer over the head, but yeah.
Yeah. So what'd they do, like rhinoplasty, stuff like that?
They used to do all kinds of things, facial, cosmetic surgery, rhinoplasty.
Yeah, because there's no way Cleopatra was a natural beauty. I've never thought she was a natural beauty.
Actually, I don't know if you realize, but in ancient Egypt, parents used to shave their children's head by sort of molding them while they were growing.
No kidding, huh?
Yes.
Wow. That would be the explanation for my skulls that exist today. We're going to talk about that further. I mean, we're talking about butt lifts and stuff, but I'm going to give you the same message I give scientists when they do research. For God's sakes, come up with a way to grow hair. I don't care about butt lifts. I don't care about anything else. Come up with a way to grow hair. Nick, one of my producers here, and I, that was the question we wanted to ask you today. Are they ever going to come up with a way to grow hair?
Well, you know what? Actually, fat may be used to grow hair one day. The amazing thing about fat these days is people realize that fat has a lot of stem cells,
right?
So embryonic early cells that are able to rejuvenate tissues. So maybe one day, I don't know, 5-10 years from now.
In other words, if George W. Bush was still president, you wouldn't be doing butt lifts. I'll tell you that right now, because he hated stem cells. That guy hated them.
Yes, he did.
Yeah, because I understand that you're taking fat from other locations in a person's body and putting the fat into their butt. But if you could figure out a way to take hair off Nick's back and put it on top of his head, or hair out of my ears and put it on top of my head, I would be forever appreciative. Especially if it's just one injection. That'd be fantastic.
I'll see what I can do.
Listen, I have a luxurious ponytail inside my ears, and you've got to see Nick's back. It's, I think he has it permed. Don't you have your back permed once a month?
Not till next Thursday.
All right, not till next Thursday, yeah.
You know what I can do for Nick, actually?
What?
We could make him some nicer breasts. The fat can be used not only for the butt, but also for breast enlargement.
You know what? It's hard enough getting him to come to work on time. If you give him breasts, I think he'll... Yeah, Jim Richards, there's a good guy for you. Jim Richards needs better breasts. Jim's cleavage is almost embarrassing and wrinkled. Yeah, his nipples. Yeah, thanks, Ricky. Okay, now we were trying to make this a mature conversation. We don't want that woman from Mississauga to call in again, like she did yesterday on the prostitution angle. Now, let me ask you this. There's obviously a market for this. Like, I always thought people wanted smaller butts. But the way it sounds, like, well, first of all, why do they call it a Brazilian butt lift?
It's very popular in South America. A lot of Brazilian surgeons do this. This is a surgery that's been very popular in South America, and particularly in Brazil.
Right. And so literally what you do is you take the fat, you inject it in certain areas.
So it's a great procedure. It's a 2-for-1. You do liposuction. You take fat from the areas.
Did you say it's a 2-for-1?
It's like a 2-for-1.
Meaning each cheek.
That's not what I meant. What I meant is it's like two procedures in one. The first procedure is the liposuction, where you take the fat from the areas where you don't want it. So you get liposuction.
Right.
And then instead of throwing the fat out, the fat is carefully processed and injected into your butt to sculpt the behind.
All right. Give me an example of a place where you take the fat from.
Most commonly, I go to the belly and the love handles.
Right, because that's where people want it gone.
That's where they want it gone. That's where usually people deposit their fat, and that's a great thing that when these fat cells are taken from these areas and put into the butt, they maintain their intrinsic properties, which means that when you gain fat, if you normally gain it in your belly, now you'll be gaining it in your butt, so your butt will grow.
All right, now let me ask you this: how many of these things have you done, say, this year? How many butt implants have you done?
I was just looking at my stats. I think we're looking at about 50 patients.
50, really?
Yeah.
Now, how many of those were women?
I think pretty much everybody.
Okay, so no men. You haven't had any men yet.
I did have a few men that wanted to have this procedure. but unfortunately did not qualify because they were too skinny. That's one of the limitations of the surgery.
Right.
If you have no fat to give, then I can't transfer the fat.
You know why I'm asking? Because going back 3 generations of my family, the men were known for having no ass. Our spine meets the back of our legs. It's just we have no ass. And I don't know if you notice this. I have no earlobes.
Uh-huh.
You notice that? That is probably the only reason we have no gay men in our family, because there's no place to put the earring. Maybe we had people in our family who wanted to be, but they just couldn't.
Well,
but that's a weird thing, too. No earlobes and no ass.
Well, if you would like to have larger earlobes, you can have fat grafting to your earlobes, too.
Really?
Yes.
Okay, good. So that's good to know, because there is another side to me that I'd like to explore. I just need to be dressed for it to go out. Thank you very much. That's
You're
great.
welcome.
Now, how much does a procedure cost?
The procedure ranges from about $4,500 to probably about $8,500. Depends on how much is being done.
Or the size of your ass when you get there?
Pretty much.
If you got a large ass already, it's probably $8,500. Does it go like CCs? Like if you want to, do people come in and say, hey, I want a giant ass?
It depends on how many areas need to be liposucked to harvest the fat, how much work is involved, how long the procedure takes.
Right. Okay. Now, how long is the recovery?
Recovery, pain-wise, is a few days. Patients go home on pain medications, so they're comfortable on something like Percocets for a couple of days, and they can switch over to something lighter. The key aspect to recovery after these procedures is that there can be no direct pressure on the areas that had the fat grafted in, because the fat is very fragile. And so I ask all my patients that they do not sit or lie on their back for 2 weeks. So for 2 weeks, they can stand, they can lie on their stomach. If they need to sit for a brief period of time, I ask them to sit on a very soft pillow and keep it to a minimum as much as possible.
So no sex for unimaginative people.
I guess.
Yeah, people who only know that one, position. What about going to the bathroom? How do you go to the bathroom?
I guess that's something that they have to do, and there's no way around it.
Beyond the Mic with Mike Bullard, every day, News Talk 1010, noon to 1. I'm with Dr. Martin Jugenburg, who is a reconstructive and plastic surgeon, who is, I guess, a pioneer of the Brazilian butt lift in Canada. And he's got some very interesting insights into this. And the numbers are 416-872-1010, star 8255, star talk 71010. Can I have, like, our 7th caller receive a free butt lift? Yes, you can't do that.
I can't.
Oh, that would have been great if we could have done that. Would have been fantastic. Now, do you ever have someone come in and say, no, I'm not doing this because there's nothing wrong with your butt?
Absolutely.
I know a lot of plastic surgeons, when somebody comes in for a procedure, will talk to them first and make sure that the reasons are good before they get any procedure done, right?
Absolutely. It's essential that each patient is screened properly. I hope people don't have the imagination that when someone comes to a plastic surgeon's office and they throw a bag of money on a table, that we'll do anything they ask for. When a patient comes and sees me, I sit down with them, I spend good time talking to them. We discuss the procedure, the limitations, the potential outcomes, and what to expect from the surgery. And of course, they have to pass a physical examination. They have to be overall healthy.
Right.
They have to be physically and mentally ready to undergo the procedure.
Right. Okay. Now, what's the strangest thing anybody ever asked you to do?
In terms of butt procedures?
Doesn't have to be butt.
I had a lady who wanted to have cat eyes.
Yeah, that is freaky. That's a sign of somebody who's had too much, too, right? If they have too much, they get the cat eyes?
I told her it's not my area of expertise.
Yeah. See, I'm a dog guy. I'm not a cat person. That's the other thing that bugs me about that. Why would professors come in and ask for cat eyes? I'd ask for dog eyes. Dog ears is good, too. Yeah, Ricky says I should get dog ears. Yeah, those floppy ones. That's right. That's right. Now, did you do it?
No, I did not. I explained to her that it's something that I don't think is ideal. It's probably not something I would feel comfortable doing.
Right.
And
I don't have a good bedside manner. I wouldn't have made a good doctor even if I could have passed all the what are they, tests? Exams. What do you call them? What do you call it? I'm like the Jethro Bodine. Remember Jethro Bodine? Every week he wanted to change his profession. I couldn't do it because if somebody came in and said that to me, I'd go, look, you're nuts. Get out of here. Basically, I would be quite blunt when somebody came in. I wouldn't take a gentle approach with them, right? And that's obviously why you're a doctor, because you're a good guy. Now, you're married, right?
Yes, I am.
Okay, so how do you put your wife off? I've always wanted to ask a plastic surgeon this. How do you put your wife off? I mean, if you're married to a plastic surgeon and you're a woman, every time a new procedure comes out, you go, look, I'm popping by the office today. I want this done, and I want it done today. How do you put them off, or do they ask?
So far, I did not have to face that problem.
Right, okay. Did you marry a natural beauty?
Yes, I guess.
You shouldn't have said You got to go home after this interview. You should not have hesitated whatsoever. All right, guess. Yeah.
I'm in trouble now.
Yeah. Now, so your wife has no interest in plastic surgery.
No, she doesn't.
That's great. And I talked to another plastic surgeon a couple of years ago who told me the same thing. His wife has absolutely no interest in any of these procedures.
She's beautiful. She's fine as she is. And I guess she married me before I was a plastic surgeon.
Right. I guess it's like being a GP and married to a woman who wants a constant cold. You know, she's constantly got a cold. Oh, no, I'm not helping you. No, I like you. I like you the way you are. I guess that's the way that works. Yeah, I guess you'd get tired of it if you saw it all the time, right? Like, last thing you want is a wife with augmented breasts, right?
Yes.
You know what I mean? It's like, having sex would be like bringing work home. I don't think I'd enjoy that whatsoever. I don't think I would. Now, let me ask you about the anti-aging show. You're doing that.
Yes, I am.
Now, when does that take place?
That's taking place October 15, 16, and 17, Friday, Saturday, Sunday. I'll be there for those 3 days. I'll be performing injections with Botox and fillers. And also on Saturday at 1 p.m., I'll be talking about the Brazilian butt lift and fat transfer to the butt and to the breast for breast augmentation.
All right, now where's this going to take place?
It's taking place at the International Center, 6900 Airport Road in Mississauga.
It's in Mississauga?
It's in Mississauga.
Oh, man. I live in Mississauga, Doc.
You can come over. We'll get you a free ticket.
I can tell you right now, the mayor will be there for a facelift. That's got to... Sorry, I'm coughing. And I live in Mississauga, and let me tell you something. That place is butt lift heaven. You're going to have them lined up. You're going to be working from now until 2015 on the butt lifts. I live there, I know. I'm telling you, what you're doing it's charity work, what you're doing that weekend. It really is. Now, where's your office?
My office is under renovation right now. It's at the Royal York Hotel, downtown Toronto.
Fantastic.
And I also work out of two other sites, the Humber River Hospital and the Plastic Surgery Clinic in Mississauga.
All right. And, I want to thank you for coming in today. It was beyond fascinating, actually. Hey, by the way, do you remove tattoos?
No, I do not.
All right, because I've got one on my shoulder that says Dave Forever. Maybe we can change it. Okay. All right, Dr. Jugenburg, thank you very much for coming in today.
Thank you for having me.
And you're listening to Beyond the Mic with Mike Bullard.